Hello all of you, welcome. So in my clinical practice I have noticed that in last 1 to 2 years the number of patients who came to me with complaint of hair loss have drastically increased, and many patients they complain that they had a history of fever, maybe COVID-19 related fever or some other stressful condition, and then they experienced increased hair loss. So today I am here to explain that why this type of hair loss occurs and whether you need to worry about this, whether this is a worrisome condition, whether this is a temporary hair loss or is it a permanent hair loss. Literally patient have cried before me because of that excessive hair loss which has suddenly seen in these patients. They suddenly one day wake up and notice that around 200 to 300 strands are falling off, and every time they comb their hair follicles more and more hair follicles are coming out, and then they get too much stressed and worried about this condition. Now for all the medical students out there, I would suggest that these are few articles which I would recommend you to read, like Telogen Effluvium, which is a sequel of COVID-19. You will freely find this available, you just need to Google it. Similarly, COVID-19 infection is a major cause of acute telogen effluvium. Now this year's in NEET PG exam, that is NEET PG 2022 May exam, which was conducted few days back, a question was also asked regarding telogen effluvium related to COVID-19 infection. So this is very important for all of you, and this is also a very interesting read. The year America's hair fell out. Now let me explain what is happening in these patients. See, this is a normal hair cycle. This is a normal hair cycle. In this normal hair cycle, what happens that normally all the hair follicles they keep on growing. This growth phase is known as anagen phase. So anagen phase is what? It is the growth phase, and these hair follicles keep on growing for many years. The average duration is around 3 years. Okay, so for many years these hair follicles keep on growing, and here they are having this blood supply, so they are well connected to the blood supply, and these are nourished good growing hair follicles. Okay, so this is the active growth phase. Now there is a small transition which occurs, and this is known as the catagen phase. So after the growth phase is completed, this transition phase starts, and this is a very short phase, and as you can see that there is decreased blood supply to the matrix part, the bulb part of the hair follicle, and this lasts for only few weeks. You can remember it easily, 3 years, and this is 3 weeks. Okay, now then after these 3 weeks of transition, telogen phase starts. Telogen phase is the resting phase, and the average duration is 3 months. Now as you can see that here the dermal papilla is separated from the root of the hair follicle. So here the blood supply is gone, the nourishment is gone, and now this hair follicle is going to shed off. So that is what happens next, that is it sheds off. Now this is a normal hair cycle. So normally this is happening, and when normally this is happening, around 50 to 100 strands of hair follicles they are lost. So there is loss of hair follicles, and 50 to 100 hair follicles which over whole scalp is the normal hair loss which can occur in any individual. This is normal. Now what happens if stress sets in? This stress can be in the form of COVID-19 infection or any other stressful condition or other fever like typhoid fever or pregnancy or any chronic condition. What will happen now? What happens that all these hair follicles which were normally growing, now they start entering into this final phase or the resting phase, that is telogen phase. So different hair follicles which are in anagen, catagen, these start entering where? Into the telogen phase. Why? Due to this, that is stress, COVID-19 fever or typhoid fever, and all these hair follicles are going to enter where? They are going to enter here, that is in telogen phase. Okay, so normally 50 to 100 hair follicles are going into telogen phase and they are shedding off, but here thousands of hair follicles, hundred of thousands of hair follicles, they start entering into this telogen phase, and they are not going to fell off right now. Why? Because this phase is going to last for 3 months. Okay, so let us consider that today the patient had COVID-19 or any chronic illness. Now the hair follicles which have entered into this telogen phase are going to stay here for next 3 months, and after 3 months of this, what will happen? A drastic hair loss will start. Hundreds and thousands of hair follicles suddenly start falling off, and the patient get worried. Patient is in a panic state, and patient rushes to the dermatologist or starts taking multiple vitamins or hair oils and changes his hair shampoo. But all these things are not going to work. Why? Because it is due to telogen effluvium, that is TE. And telogen effluvium type of hair loss doesn't need any treatment, because this is just an excessive hair loss which has occurred due to this stressful condition. And once this stressful condition is gone, all these hair follicles are going to grow up and they are going to come back, and again this hair cycle will start, that is telogen followed by anagen hair follicles, and this hair matrix start forming the new hair follicle, and there is a return to the anagen phase. Okay, so though this is very stressful for the patient, if the patient is having hair loss due to that trigger, that stress or COVID-19, then this is telogen effluvium. And if the patient is having telogen effluvium, need not worry, because all these hair follicles are going to come back, whether you take these multiple vitamins or hair oil, or whether you don't take them. Now I thought of doing a Google trend here, and to find out that how many individuals have searched this condition over Google. So telogen effluvium in India during this duration, that is the COVID-19 phase, and all of you know that it was March 2019 somewhere here that the COVID cases started to increase. And as you can see that within a period of 3 months from here, this trend is increasing. So this trend is increasing. So you can see that there is a trend increase in the next 3 months of this when the cases of COVID started to increase. Similarly, the second wave, which was around April, which was around April and May 2021, where there was a lot of chaos and a lot of COVID cases were seen, and you can see that suddenly there is a spike, and more and more patients wanted to know about this condition, that is telogen effluvium, and more searches were going on. So you can see that there was a uptrend in the search of this condition, that is telogen effluvium, and it has been seen in the next 3 months. Okay, so what is happening, that after every 3 months of this spike of the COVID-19, whether it is first wave or the second wave, there is an uptrend in the search of this condition, that is telogen effluvium. What are the cities in India where this was more common? Like you can see that more searches were from those literate states of India, like you can see Kerala, Delhi, Karnataka. So most of the patients, they went to dermatologists and were diagnosed as telogen effluvium, and then they came back and started searching for this condition. So you can see the trend is more common in these states of India. So I hope that this was useful for all of you. So remember that whenever there is some stressful condition or condition like COVID-19 or typhoid fever or pregnancy, sometimes patients start experiencing excessive hair loss, and this excessive hair loss is generally sets in 3 months later to that trigger or that stress or that fever, and this is known as telogen effluvium, that is telogen effluvium. Okay, and this type of hair loss is very easy to manage, because all these hair follicles are going to come back. This is a temporary type of hair loss. This is a non-scarring type of hair loss. So I hope this was useful for all of you. Thank you.